Simon here from Empirical Health. Recently I had the privilege of speaking with Dr Arnaud Versluys in New Orleans in regards to the importance of classical administration techniques of some of the formulas from the Shanhan Lun and the Jingui Yaowei. Put together a short video of that interview, so hopefully you can learn something and enjoy it.
I would think that if you want to practice Chinese medicine in what I personally would consider to be like the highest level, which is really going back to the roots of the medicine, Han Dynasty style, canonical methods, canonical formulas, which is, Shanghan Jingui is like the clinical application of herbs from the canonical period of the Han Dynasty. If you truly want to go to that level of practice, you have to indeed, it's not enough to just say, oh, I write Shaolin formulas. You have to indeed start to observe the traditional preparation methods, the advice that was given behind every formula. There's a passage that gives you advice on how to take it. When you take this formula, don't eat this, don't eat that. From Hoshu Heisan, it's like you have to put some cold food in your stomach because then the herbs don't dissolve too fast. They stay in your stomach longer overnight. For example, when it says like don't eat fishy things, don't eat garlics, don't eat those kinds of things while taking this formula is very important. For example, a good example would be Tang, which is one of the primary formulas for pre-existing taxation disease that now, with symptomology of cardiac dysrhythmia, that is now newly triggered, exacerbated because you catch a common cold, you catch a cold damage, and so it causes palpitations, arrhythmia, and things like that. So this is obviously a blood pattern. This is a pattern where the blood of the heart, if you want to put it that way, is too weak, and the yang of the heart is too weak, and that causes the heart rate to be irregular. But that's a blood pattern. If you look at the layers, chi layer, water layer, blood layer, that's a blood layer pattern. And so during the preparation method, it'll say that you have to boil the decoction in half water, half alcohol, because what we know about alcohol, what it does is that it changes the layer that the herbs will go to, or at least it puts an emphasis on, it increases the permeability, and the herbs are much more easily going to go into the blood layer. And in our system, we talk about how, it basically allows through the small intestine actually to be absorbed better into the blood layer of the whole system, right? And so if you're using these formulas, but you're not really using that method that is very clearly described as the principal method of administration, or the most important one, you're kind of not fully using that formula. You're not really fully exploiting the full efficacy of the formula. You're not going to be able to formula. So those things are extremely important. And so when then looking at, so that's just on the methods of administration and things like that, right? Like how do you boil it and things like that. So then that's the same thing then carries into like the pills or the powders, right? Let's say you do a Wuling San and you make it into a decoction. Undoubtedly, that's going to change something, right? In the Jingui Yuhan Jing, which is the jade casket inside the golden cabinet, it's a classic, also compiled by Wang Suhe in the Jin Dynasty, based on the manuscripts that he found, which are remnants of the Shahanlun and the Jingui Yalue. So he made a Shahanlun, he made a Jingui Yalue, as we know, and then he actually had a third kind of manuscript that he compiled that he called the Jingui Yuhanjing. And in there he talks about decoctions are very powerful because the power of water is so strong that it can float a boat, but it can also overturn a boat. So the most powerful would be a decoction because it can wash your organs clean and it can nourish you, right? And so a decoction is kind of like to nourish you. It's often used to nourish you, right? Or to wash the organs, as he calls it. And then he says the powders are more, Ming dynasties, Li Shizhen says powders are more dispersing, right? Sanzi sanye, powders are more dispersing. So then the powders, he says, you use them when there is like channel pathologies, pathologies in the external cold or external damp, and pathologies that are stuck in the extremities, and B syndromes, and they need to be dispersed, they need to be opened, they need to be moved. So along the same lines, if you then think about, for example, a Wuling-san, the fact that it's used as a powder means that the goal is to actually not add more water because you're already not urinating properly. You're not going to add more water by giving a decoction because you're not trying to just like nourish the body. You're actually trying to disperse the water that's already stagnant in the body. So it should indeed be used as a powder, but it works better as a powder. And so if you're then going to use it as a powder, then you have to follow the traditional preparation method of how to grind the ingredients. Because the full efficacy will only be able to be realized if used exactly the way the author of that prescription intends it to be used. Because he's the person who knows it best. He's the designer, not only the designer, he compiled it, he distilled it from other texts and learned all those things. And so you have to use it based on how he or she, but in this case, he intends it to be used. Right? So you have to make the traditional preparation, because then you can truly realize the full effect of the prescription. It doesn't mean that as a granule, for example, a lot of people use granules. In my clinic, I sometimes use I use granules as well, right? Not by choice. I mean, I wish I could use decoctions all the time, like we used to do in China with my teacher. But you use a granule, it works, but it's never going to work as well as if you use the truly traditional preparation method. So if it says powder, it has to be powder, and the powder has to be prepared exactly the way Zhang Jing tells you to make it, and the instructions have to be followed as to if he says don't eat fish, or if don't eat raw food, or don't eat this or that. You have to follow those, and then you can really realize the full potential. Right? So that's extremely important, and I would almost say that obviously the most important, most decisive factor as to whether herbal treatment will work is whether you were able to properly diagnose and establish exactly the formula that needed to be used for this particular patient in this particular situation, right? But sometimes, even when using the right formula, the result is not 100% as desired. That can have a lot to do. I'm not saying it always has, because there's many variables in clinical reality, but it can have a lot to do with the fact that you weren't using herbs. To give another example, right? There's a prescription in chapter 21 of the Jingui, 21 of the Jingui, which is Guizhi for spotting during pregnancy due to the fact that a patient has growth in the uterus. Could be cysts, could be fibroid, could be tumor. That's not specified in that time. But it says you do have to get rid of the bad blood. You have to get rid of the blood stasis in the uterus, because otherwise this spotting will never stop. So he uses Guizhi 1. When used as a pill, we call it Guizhi 1, right? He says very clearly, you start taking a little bit. If it doesn't work, you take a little bit more. It's done because it has to be safe. Using blood-moving, blood-precipitating, blood-descending herbs during pregnancy can potentially be risky if, of course, this patient already doesn't have a very strong pregnancy, for example, doesn't have a strong constitution. The strength of the herbs might overpower the patient and so forth. So you use it as a pill form because it's easier to dose and it's safer, right? So you start with a little bit, take a little bit more. That very prescription, the same ingredients, Guizhi, Xiaoyao, Tauren, Mudanpi, Fuling, the same ingredients, if used as a decoction, is actually known as Duo Ming Tang. Duo means to snatch away. Ming means life. Tang means decoction. So, it's not a Han Dynasty formula, but I don't know exactly the era. I have it written down somewhere, but it might be Song, or it might be something like that. But basically, that was a form that actually could be used for aborting a fetus, right? So if you use it as a decoction, same ingredients, it could be way too powerful. So that would be extremely irresponsible behavior, right? Literally, pardon the pun, throwing the baby out with the bathwater, right? You would be damaging the fetus in an attempt to somehow save the pregnancy. That wouldn't be the right thing to do. So you have to, certain herbs are powerful, or certain clinical situations require it, that you use it as a pill form, and that you use it indeed very carefully the way it is prescribed. So again, you have to go back to the original text, where they are going to clearly and unequivocally tell you this is how to use it. And this is a good example because if you were to use Guijufuling-1, which is extremely safe as a pill, has been used for the last 18 centuries as a pill, absolutely effectively and absolutely safely, but if used as a decoction, it becomes a totally different animal, and it could actually be very risky. Right? So it is extremely important to observe those rules.
And would there be a process that you would advise people to, when they want to learn how to use these formulas? Should they start? Where should they start? And is there a pattern that you think they might be able to follow?
Well, I mean, the traditional training in our family lineage, so this is the Tianzheng lineage, Dr. Tian, my teacher is Dr. Zheng, and then fellow disciples of Dr. Zheng, right, of the hierarchically at the same level. So I've had the fortune of meeting some of them and studying with them. And so in the traditional system, Dr. Tian would first tell you to learn the formulas, standard. And in the first 2 years, or maybe a little bit longer, depending on how good a student you were or not, right? You were absolutely not allowed to modify them. You had to use them the traditional way, whether it's a powder or a pill or whatever. And as I was telling it today in class, I was actually telling about how Dr. Tian would tell people, okay, you go to that person to get your Senchi-1 pills made and, traditionally prepared. And then he would say, basically, as a beginning student, you're absolutely not allowed to modify formulas. Absolutely not allowed. Right? Then, after 2 or 3 years of working with the unmodified formulas, you kind of start to get a little bit of a grasp of the potential of these formulas in unmodified form. Because when you start to learn formulas from the get-go and you modify them from the get-go, you'll actually never know what these formulas are capable of unmodified. So first you have to establish what these formulas are capable of unmodified before you can actually start to make a properly informed decision on, now I need to start modifying, right? So you have to use a certain formula 20, 30, 40, 50, 60 times, 100 times unmodified. And then you'll start to realize, okay, in a clinical situation, this formula is capable of producing this result, that result, unmodified. And if I encounter a situation that is more severe or more complex, then only then will you know, actually this is beyond the scope of what I have seen this formula achieve in unmodified form. So I need to modify. So then after 2 or 3 years, Dr. Tian would tell the students that they were allowed to modify. However, they were only allowed to modify by using Zhang Dongjing's own classical standard modification methods. And as when you read the text, for example, Xiao Cai Hu Tang, Zhen Wu Tang, Sen Yi San, Xiao Qing Long Tang, there's a lot of formulas. There's not a lot, but there's some formulas. Xiao Cai Hu Tang is a very good example where he has a very clear paragraph that follows the prescription where he tells you, now if there's also this symptom, you modify by adding this herb. If there's that symptom, you take this herb out and you add that herb in. If there's and so forth and so forth, right? So for example, if there's a cough with your Xiao Cai Hu Tang, you take your Renshen and your Da Zao out, then you change your Xingjiang into Ganjiang and you add Wu Weizi. Okay? If you have a Xiao Cai Hu Tang pattern and you're very thirsty, the patient is very thirsty, right? You take the Bansha out, you increase the amount of Renshen, and you add the herb Tianhuafen, etc., etc., etc. So there's a system that Zhang Dongjing himself has provided us with, telling us how to modify formulas. So then Dr. Tian would tell his disciples, the next few years, you can start to modify. You've seen what they do unmodified. You can start to modify, but you can only start to modify with the classical modification methods. And they would have to do that for a few years. And then ultimately, then they would be allowed to make modifications through formula combination. Right? And formula combination is what Dr. Tian always called Chao Zhi, the Chao Zhi treatment. And Chao Zhi, Chao means like, in Buddhism we would call it pith instruction, like a secret key instruction, very direct, like the key to the practice, right? So basically, the very essential instruction. So he would teach them like, this is the key. Like you can, if you realize like how the architecture of the formula works, how certain herbs in these formulas are overlapping, then actually these formulas have a certain degree of compatibility. And if you have coexisting problems, diseases that are existing in one patient's body at the same time, you might be able to tackle both of them by combining formulas, right? But that is considered to be a much more advanced level of modification, and the disciples would only be allowed to do that after a number of years, like maybe 5 or 6 years, depending on how smart they were, but depending on how hard they worked, right? So that's kind of like the progression of how we traditionally learned, and this is the progression of how I teach the students in our institute. This is because we are trying to emulate a traditional discipleship educational model, but in a classroom format, right? And so, but the rules still apply, right? And so we always talk about that the highest form of modification is non-modification. The best practitioner uses very little or no modification, right? The second highest then would be that you still modify, but you only modify according to the rules as laid out by the original author of the prescription himself, Zhang Dongjing himself, his own rules. And then you can modify using formula combinations. And later, then you can have maybe some clinical modifications based on the experience of your master, of your teacher, of the people instructing you in the system, right? But that's much later in the system, in your training. So that's, once you know the rules, then they'll give you a little bit of leeway in breaking the rules. But in the beginning, it's just drilling the rules. You're only allowed to drill the rules. Yeah, so that's the traditional colleges and people who are coming out with these fake diplomas. Nobody knows how to see patients anymore. The actual skill level is very, very low. The actual ability to really fix true, real problems is really poor. I'm not talking about, some lower back pain, a little bit of headache, that kind of stuff. Okay, a lot of people know how to do that, okay? A lot of people know how to relax you with a little bit of acupuncture and things like that. But truly, that's not real medicine. This is true medicine. This was the first line of defense against illness. This is true primary care, a full-fledged, standalone, self-contained medical system that does not require external validation. It has been that way for the last 1800 years. And that's how Chinese medicine people are like, no. Chinese medicine isn't dead yet. It is still alive. It can still be revived. It just takes a lot of work to do so. And there's a lot of committed individuals that I know that are working on this, and you're clearly one of them. Like the work, like we say in American English, not to blow smoke up your ass, not to boast or anything like that, or not to like somehow what's the word? Can't think of the word right now, but I don't have anything to particularly here say like, oh my God, Simon, you're such an amazing character. However, when it comes to your research on how you prepare these pills, how you find the proper ingredients that have to go into the pills, differentiating the proper botanical species, figuring out the proper dosaging of the ingredients once you figure out which ones the actual ingredients are, the boiling times, the steaming methods, how to squeeze the juice out of this or that and the other, the size of the egg yolk of the Han Dynasty egg, which is what we were talking about today. All that research is so necessary, so valuable, and it should be the basis. It should be self-evident that that is important. And I regret to say that you're one of the very, very few people doing this kind of research. I know a few other people who actually, I'm very proud to say, are also connected to our institute, who are also doing a little bit of that work, or have done a little bit of that work, right? But most of the research on preparation and on plants is going in the biomedical direction, which has nothing to do with classical Chinese medicine, and will never, ever improve your clinical efficacy because it's not part of the system, right? Biomedical research does not contribute to the efficacy of classical Chinese medicine because it's a different language and it has nothing to do with it. Biomedical findings also should never and will never be able to supersede traditional findings because they never will have the 1800 years of traditional use that has clearly demonstrated efficacy and safety in a myriad of clinical situations, right? So biomedical science doesn't really contribute anything to traditional medicine. right? And so, I cannot commend you enough when it comes to how you put effort in trying to revive the traditional, the pills and the powders, and teaching people how to use them. I'm the prescribing internist, and there's other people who are the pharmacists, and that's also something that a lot of the practitioners out there need to realize. It is impossible that they themselves are going to be able to fully understand the intricacies of the preparation methods and the dosaging and which herbs and that and that and that. All they need is they need to maybe just become the internist who is really good at prescribing, diagnosing and prescribing for their patients, and then trust in the expertise of an expert who has really put a lot of work in figuring out the proper preparation methods of making the pills and the powders and things like that. So they can say, well, I with full confidence know how to diagnose, and I know that this is the formula that you need, this and this pill, this and this powder, or this decoction, right? Now, this is the person who I trust the most to deliver the proper pill, the proper powder, the proper decoction. It's going to be the right herbs, going to be in the right dosage, the right instructions for preparation, because when all these factors come together, that's when the maximum efficacy is achieved. And that's how it works. That's true classical Chinese medicine.
Fantastic.